Hello there, everybody. Welcome back. All right, we're going to conclude routes and formulation. This is a two-parter, so if you didn't catch part one, go back, watch that, and then continue on with this one. This is part two. All right, last time we covered the difference between enteral and parenteral routes, and then we covered all the formulations for the 4 enteral routes. So today we'll cover the parenteral routes and their formulation. So what you want to watch out for is local or systemic effect, and or both. All right, parenteral routes. So if you can't do PO, if you have to do it fast, if the patient's out or a child uncooperative, doesn't have a GI tract, then you got to try something else. So you got to go outside of the GI system, outside of the intestine. For IVs, make sure that they are sterile. Right, so here are some of the IV routes. So we will not be practicing any direct IV injections like this. Right, we'll do venous puncture, but we won't be injecting drugs directly into a vein. So for us, IV is going to be a big old infusion. Right? So a big old bag of IV. Intramuscularly, the angle is going to be at 90 degrees. And you go at least an inch into the muscle. Since there's a lot of blood, this is relatively fast. Subcutaneous, the angle here is 45. And that goes into the fat layer. Since there is not a lot of blood, this absorption is relatively slow. Intradermal, so this angle should be about 5 to 15 degrees. And since there is no blood supply in the epidermis, this one's going to be very slow absorption. So let's give some examples. So in the deltoid, we give an IM injection for the flu. Into the fat layer, in the abdomen area, we give insulin under the skin. And for intradermal injection, we usually do allergy or TB screening. In other words, the purified protein derivative. Intravenous, directly into a vein. So this will be the IV bag that will be attached to the patient. So you can infuse quite a bit of things, IVs, even a fat emulsion. You can inject suspensions. Lyophilized, that's just a fancy term for freeze-dried powders. So like the PO meds, you'll still need to reconstitute those with the correct diluent. IVs must be pH balanced and isotonic. So the pH of blood is 7.4. So it's just a little bit basic. Isotonic means kind of balance with the amount of stuff. So there's blood cells, salt, proteins, sugars in your blood. So the solution you enter into your blood must be about the same. So for blood, that number is 300 millismoles. So just remember the number 300. So for IV routes, very common, inside the elbow, the back of the hand, or the top of the foot to access large veins. Intravenous push. So intravenous push for us, since it's loaded in a syringe, the verb's going to be inject. So we're going to inject the drug into the tubing. So the fluid stream of the tubing set. Piggyback. So a piggyback is usually placed a little bit higher than the IV. So this would be the large volume IV bag. So here's the IV PB. And because of gravity, the PV bag will infuse first before the intravenous bag. Nowadays we'll use a lot of pumps, so this one will help regulate infusion without relying on gravity. Other pumps that are available: PCA pumps, patient-controlled analgesic, where they can regulate the maximum dose. Next parenteral route, IM. So this is inject at a 90-degree angle into the muscle. So at least a 1-inch to maybe 3-inch needle if need be. The largest one, 5 mL into the gluteus maximus. So for the flu, it will be in the deltoid, gluteus maximus. So kind of dangerous. You'll need to avoid the sciatic nerve there. Z-track is a special method to prevent the drug from irritating layers of the skin. So if you inject into the skin, it's like poking a hole where the drug you injected can just leak out. So it's a method of staggering the layers of skin to prevent the leakage into the top layer of skin. Subcutaneous, into the subcutaneous layer or the fat layer. So if you see SC, SQ, sub-Q, subcut, that all means the same thing. So for us, insulin is the common example. Since there is no blood supply in the fat, this absorption is going to be a lot slower than into the muscle where there is a lot of blood. Common sites, so abdomen area for insulin. You can use the front of the thighs if there's adequate fat, the back of the arms, or the back itself. Intradermal, to the top layer of skin. So the epidermis has no blood supply. So we want very slow absorption. A wheal is another term for a hive. That's the bubble that forms when they administer the TB screening. Let me know if the following verbs is infuse or inject. So if it's in a bag, a large volume bag, it's infuse. If it's in a syringe, then it's going to be inject. So for IV, that's going to be in a big old bag. So that verb is infuse. Intravenous push. So they'll have a catheter site here where you can attach a syringe and you'll push the drug into the fluid stream. IV piggyback. So that's going to be in a bag. That verb is infuse. Into the muscle, inject. Under the skin, inject. Intradermal, inject. So the only two you need to memorize that are infuse are IV and IVPV. That's it. Just those two. Everything else for us in class will be inject. IV parentals must be sterile, isotonic, pH balance, all of the above. So definitely sterile. pH balance, so remember that number needs to be around 7.4. Isotonic, yeah, that number needs to be around 300 milliosmoles. So the correct answer, all of the above. Ophthalmic. Do we want a local or systemic effect when we use drugs in the eyes? So we only want local. The problem occurs when the drug drains into nasal cavity to the back of the nose and then you swallow the drug, turning it into PO, making it systemic. So eyes, only local effect should be desired. Any systemic effect is a medication error. For drops, you want to instill drops into the eye, but for creams or ointments, you want to apply. So to apply ointment, pull down the lower lid, apply the ointment to the pouch that's created, and then have the patient blink a few times to spread the ointment. Into the nose, local, systemic, or both. So if you have swollen blood vessels, you want a local effect. Steroids and allergies, you may want more of a systemic effect. MDI, meter dose inhaler. So for every spray, you'll get an exact measured dose. So remember to tell these patients these are nasal inhalers and not to use by mouth. Inhalation into the lungs. So depending on the size of the particle will determine how far into the lungs it may reach. So that means you might be inhaling powders. Yes, there are some drugs that are inhaled powders. You can also inhale atomized solutions, a mist, a suspension, even an emulsion. Local or systemic effect. So if we want to open the airways as in asthma, then that's going to be a local effect. But if we're giving you general anesthesia, we want the drug to enter your bloodstream and then work throughout your whole body. So in that case, a systemic effect. Patients may be prescribed a spacer to coordinate actuations, especially with children. It's hard for them to time the spray, the actuation with the inhalation. So the spacer will allow the vapor to be contained in the container, and then they can inhale it from there. Speaking of powders, these discus, you pop a blister cap and inhale a powder. Let me know if the following routes we want a local effect, systemic effect, or both. So into the eyes, we would like only a local effect. Remember, do not swallow what drains in the back of your throat. Into the nose, that's going to be both. Do we want to reduce congestion right there in the nose, or do we want to deliver hormones, antihistamines? Inhalation, that's going to be both. Asthma meds, bronchodilators, work in the lungs. General anesthetics, they're going to be absorbed into the bloodstream. Give an example of each of the following. What's given into the muscle? Every year you get the flu shot, deltoid. Under the skin, that's going to be in the abdomen area for diabetics, insulin. Lastly, into the skin, so we can test allergies because we want slow absorption or detection of antigens, in this case, TB screening. All right. Next, we got the dermal route. So local, systemic, or both. In this case, both. If you have an allergy or a rash, then you want local. But if you're applying hormones, then you would want the drug to absorb through the skin into the blood supply. So a lot of different forms available. Let's see. Colloids, they're just a superfine suspension. So there might still be solid particles. So you might have little specks of silver or gold in your cream or ointment. Here's an example of nitroglycerin ointment. So to measure that out, all you got to do is squeeze out 1 inch. So if you squeeze out 1 inch, that's going to equal to 1 gram. So here you're going to squeeze out the dose, use the applicator, and leave the applicator there after you applied it. Vaginal route, local or systemic. Well, if you have an infection, like a yeast infection, local. But if you're administering hormones, then you want systemic. So in this case, it is both. Tablets for vaginal use are also called inserts. So anytime you're using a tablet, you're going to insert into the vagina. All right, let's do some review questions. Let me know if the route or dosage form is used enterally, parentally, or both. So remember the 4 enteral routes: PO, SL, BUC, and PR. So if it's not one of those 4, then it's parental only. Buccal, well, that's one of the 4, enteral. How about inserts? Inserts are used vaginally, so it's not one of the 4, parental. IUD, intrauterine device, so the uterus is not part of the GI tract, parental. Tablets, we can take tablets, we can also insert tablets vaginally, so that's going to be both. PCA, the only PCA I mentioned were infusion, like pain meds, patient-controlled analgesic. So infusions are going to be parental, IVs. Suspensions, can you take a suspension? Yeah, you can take one. Can you inject a suspension? Yeah. Can you inhale a suspension? Yes, you can. So this is going to be both. Emulsions, you can eat emulsions, I guess. You can take them. You can inject them. You can infuse them. You can apply them to the skin. So this one is both as well. Meter dose inhaler, use them for the lungs, use them for the nose, so that's not part of the GI tract. So that's going to be parental. IR, let's see if you recall what IR means. So we got extended release, sustained release, delayed release. IR is immediate release. And this refers to tablets used for by mouth. So that's going to be enteral. pH balance, things that need to be pH balanced if you're going to inject them, so parenteral. All right, not bad. That concludes part 2. So we got all the routes and formulas out of the way. Once again, thank you guys for joining us, and if this was your first time, please come back for more videos in the future. Thank you, and you guys have a wonderful day.